Hi, my name is Dr. Mathew Levine with Resurgence Orthopedics. I'm an adult reconstruction specialist and I specialize in hip and knee replacement. Today we're going to be talking about outpatient total joint replacement. Outpatient total joint replacement has been gaining popularity. Typically, patients have been doing quite well with this procedure as long as they've been cleared medically and have adequate support at home. Patients often wonder, won't I be in a lot of pain after surgery? Fortunately, we've been doing a great job assisting in pain control post-operatively with various medications that we provide, as well as blocks provided around the time of surgery. This helps limit your pain upon discharge. Recovery from total joint replacement in the outpatient surgical center is relatively no different than recovery in the hospital setting. A big part of recovery is participation with physical therapy, and of course there would be routine follow-up with your orthopedic surgeon.